Hello and welcome to this video on precision and validity. This video is a part of our series on epidemiology and biostats. I'm going to try to keep this video as short as possible. My name is Dr. Wahab Fazal and let us get into it. So what I want you to learn from this topic is to be able to solve this question. If you're able to solve this question in the end, that means I've done my job. A laboratory is evaluating a new diagnostic test to measure serum potassium levels. The true potassium level for a control sample is 4. The true potassium, meaning this is the actual level for potassium. The following test results are obtained. Basically, this is the new diagnostic test that they're trying to get. There are two scenarios. These scenarios each have different values. Scenario 1, this test reports values of 3.0, 3.1 and 3.0 again for the same control sample. So our actual potassium levels are 4, but this is getting 3.0, 3.1 and 3. Scenario 2, where the test reports values of 3.9, 4.0 and 4.1 for the same control sample. So all three of these things are for the same one. Which of the following best describes the properties of the test in scenario 1 and scenario 2 respectively? And here are all of the options. So now let us try to understand what is precision and validity. Let's look at precision first. So what precision means in its essence is how close the results are to each other. Meaning if you do the result again and again and the result gives you, let's say if you're trying to measure the blood glucose level through those finger stick measurements. So if you're doing that, this test one time gives the value of 100. The other time this same test at the same time gives the value of 150. And again you try to do it again and this gives you a value of 200. So that means these values are not very close to each other. You do it on repeated measurements, it gives very different values on each measurement. So a test is said to be precise when you do the level measurement again, it gives 100. And then you try it again, it gives 101. And then you do it again, this gives 100. So this is what precision means. So what I want you to understand is with the help of this very simple, this diagram of shooting arrows. So if you want to shoot your arrows, and based on how close the arrows are to each other, you can say this thing is the person who's shooting the arrow is very precise. So every time he hits one spot. Now this spot can be somewhere around here as well. But if he's shooting arrows very close to each other, he's still precise. But he's not hitting the bullseye. He's not hitting the bullseye, right? So there, for example, if this is our actual target, this is what he should be hitting. He's not hitting this. So what is this called? What if he hits the bullseye? What will that be called? So that's validity, meaning how close the results are to the actual value. If the results are on repeated measurement, if they're very close to each other, the arrows here keep hitting the same spot again and again, but they don't hit the spot you want it to hit. They're precise, but they're not valid. Meaning, if you hit the bullseye, that's a valid result. That's a valid result. So what would be a test that would not be precise or valid, nor valid basically? This is what it would look like. This is a result that is not precise nor valid. These values on repeated measurement, they're not close to each other, right? They're not close to each other. And they're not close to the actual thing. They're not close to the bullseye either. They're not close to the actual value either. So they're not precise nor valid. So what would be a very precise test look like? So that would be something like this. These are very precise. These values are very precise, right? But they're not in the bullseye, so they're not valid. And if you talk about something valid but not precise, that would be something like this. And this, what we have right here, is not precise nor valid. They're not close to the actual value. So what would be a very valid and very precise test? So this would be a valid and precise test. They're hitting the arrows on the bullseye exactly where we want them to hit. And on repeated hitting, this is an expert person. This is an expert person. They're hitting the same spot every time and the same accurate spot. This is precise and valid. Now let us try to solve our example again. So in our example, if the target that we had was that of 4, we had our target of 4 and we were getting the following results. We were getting 3.0, 3.1 and 3.0 again on this test, on scenario 1. So these values are very close to each other if you think about it. These values are 3.0, 3.1 and 3.0, meaning on repeated testing, they're very close to each other. You can call this test what? You can call this scenario very precise, but can you call it valid? No, you cannot call it valid because they're not close to the actual value. The actual value is 4 and it's giving you repeatedly 3.0, 3.1 and 3.0. So this is precise, but it's not valid, right? What about this value? What about this scenario? This test reports 3.9, 4.0 and 4.1. These values are close to each other. Yes, so it's precise. Is it close to the actual value? Well, yes. The actual value is 4.0 and it's giving you on repeated measurement 3.9, 4.0 and 4.1. So this is precise and valid. So let us go through our options now. Our first scenario 1, valid but not precise. Well, this was precise and not valid. So A is clearly wrong. Precise but not valid. Okay, this is correct. Valid and precise. Okay, this makes a lot of sense. So our correct option is scenario B. Scenario 1, precise but not valid, and scenario 2, valid and precise. Very simple, very easy, validity and precision in a nutshell. In the end, thank you so much for watching this video. This video is a part of our series on epidemiology and biostats. If you want to check the rest of my videos out, be sure to do that. And don't aspire to make a living, aspire to make a difference. Thank you.